Good evening, Padmaja, and a very warm welcome to the delegates to Bharat, the land of eternal Sanatan Dharma. There are a couple of issues that I'd like to delve on, especially because I just caught that phrase that you uttered, and I think that's going to be or should be the nub of the deliberations that go on for the next couple of days, action-oriented. How can India ensure that things are no longer the diplomatic speak, as they say it? Allow me to be a little bit more cynical than the other panelists, perhaps, because I'm not a diplomat. But there are two issues I'd like to, because those are the two issues that are very dear to me, and I dare say I have reasonable amount of interest or expertise, you can call it, in those. And I think those are the two issues that I believe, away from people who talk about Ukraine and diplomacy and all that, but I believe these two issues are the ones that India must enforce action, and these two are global health and climate security. So please allow me a couple of minutes, because I think these are the two things that I think the West is at loggerheads with the South, so-called South, when it comes to both these issues, and we've seen it in front of our eyes in the last 3 years. So as far as global health is concerned, I think we need to approach it with a sense of shared vulnerability. And global health governance is something that is absolutely important. We need to collaborate. We need to invest in strong health systems. The disparities in health outcomes, the co-investments in building a diverse and skilled health workforce to serve the global population, and strengthening health systems so that they are capable of effectively responding to health crises, as we've seen, and meeting the healthcare needs of populations. Now, according to WHO estimates, there could be a shortfall of 10 million healthcare workers, Padmaja, by 2030, 10 million, largely in the South or developing world. What are we going to do about it? What is India going to enforce? Action-oriented stuff as far as this is concerned. Disparity in access to healthcare, easy access to affordable essential vaccines, therapeutics, diagnostics, tackling emerging threats. That's so important. Antimicrobial resistance, pollution-related, AMR or antimicrobial resistance could claim more lives every year, 10 million, than the COVID pandemic did in the past 3 years, nearly 7 million. We have a need for a pandemic accord, a pandemic treaty under discussion, strengthening global health security to prevent outbreaks and pandemics with one health surveillance is absolutely crucial. Now, just a minute, maybe less than that, on climate security, because that's another thing that the West and the non-West or the developing world is at loggerhead. Look, the Global Climate Risk Index, or CRI, Padmaja, classifies India amongst the top 10 countries most vulnerable to climate events. India was ranked 7th in the 2021 CRI report. Approximately 75% of the districts in India are identified as extreme event hotspots, while around 40% of districts have shown a significant shift in weather patterns. Prime Minister Modi, you would remember, I think 2 years ago, he promised renewable energy capacity of 500 gigawatts by 2030, 500. That's incredible. Even West hasn't promised it. Today, our capacity is 170 gigawatt. A huge chunk of this has to, Padmaja, come from nuclear, because if you remember, one nuclear power plant powers 700,000 homes and emits less carbon dioxide than a hybrid car. What is the West going to do about it other than scaremongering? We have to really get together and, as you said, action-oriented. So these are the two things. I can talk about the other thing, development goal, financial inclusion, data, but I'll leave that to tomorrow. But these are the two things that I would like my expert fellow panelists to talk about: global health and climate security and action-oriented events.